Hello, my name is Courtney Spees, and I'm going to be doing the spinal cord injury case study. So we have Mr. White. He's 17 years old. So what the first thing we're going to do is walk in, introduce ourselves. Hi, my name's Courtney. I'll be your nurse today. I'm going to verify the patient's name and date of birth with him, so he was able to answer that. So the first thing I'm going to do is go ahead and walk in and do his QSIN. So I'm going to make sure that I know what position he is, position he is in, how many side rails are up, if his bed's locked, wheels are locked, bed is lowered, that he has his call light with him and his side table in reach, making sure that his whiteboard is updated. Then I'm going to note any like drains, tubing, any oxygen, any kind of like IVs or anything, Foley's. And then I'm also going to make sure that he has like water and, like I said, his call light, no obstacles in the room, everything that he needs. So what we're going to do first is I'm going to go ahead and, like I said, I've already verified his name and date of birth. I'm going to go ahead and ask him if he knows where he is, if he knows who he is, what date it is, and why he's here. So you can go ahead and he can answer all those questions for me. So the next thing we're going to do is I'm going to go ahead and do his neuro assessment. How are you feeling today? Alrighty. Alright, can you follow this, please? Keep your eyes focused on this as long as you can. Alrighty, will you smile for me? Alright, we're going to go ahead and have you turn your head this way. So no JVD. We're going to go ahead and look at his skin. So his skin is warm, pink, and dry right now. And we're going to go ahead and have him wiggle his fingers for me. And then we're going to go ahead and do his pulses so they're present and they're equal bilaterally. Going to check his cap refill on each hand. Check for any edema, anything like that. Alrighty, do you have any pain or paresthesia, any paralysis, anything like that, numbness, tingling? No? Okay. So I'm going to go ahead and listen to his lung sounds. Alright, I'm going to assist him to at least sit up. I'm going to go ahead and look at his back. Look at his back, inspecting his back, looking for any pressure ulcers and sores, anything like that. Alright, so his lung sounds were fine. He was complaining of a little bit weakness, so like he was having a hard time actually breathing in and out. But you know, that just is probably because of the spinal cord injury. So his respirations were equal, unlabored. His ventilatory depth was was equal. Are you having a cough of any sorts or anything like that? Any chest pain? Okay. So the next thing I'm going to do is go ahead and listen to his heart. Alright, so his heart rate is a little bit slower than what we'd like. I hear the S1 and S2 pretty easily. It's still equal though, so it's not irregular or anything. So the next thing I'm going to do is go ahead and move down. I'm gonna ask him if he has been able to pass any gas and when his last bowel movement was, which he said he has been having problems going to the bathroom, which once again, spinal cord injury might contribute to that. So I'm gonna go ahead and inspect his abdomen first, looking for any like cuts, scrapes, bruises. I'm gonna go ahead and listen. And then I'm gonna go ahead and palpate. So it's soft, round, and non-tender. Like I said though, he hasn't went to the bathroom for a sec, but that's, normal for that. We're also gonna palpate his bladder. Okay, and then I'm looking for any discharge. He says he's not having any pain while urinating, so that's good. So now we're gonna go ahead and do his lower extremity. So I'm going to go ahead and be looking for edema. So no edema is noted. I'm going to feel his pedal pulses. So those are present. I'm going to go ahead and ask him to push and pull. I'm going to do his cap refill on each toe. And then I'm going to ask him if he has any pain, a numbness, tingling, any paralysis, paresthesia, anything like that. So, sorry, I'm just looking back on my notes here. Alright, so, he has some weakness in his lower extremities, but that's also because of the spinal cord injury. So the next thing that we're going to do is he has some ordered nitroglycerin 0.4 milligrams sublingual. So the first thing that we're going to do is get his vital signs again. I already did that with my assessment, but I'm going to do it another time before I give this. I'm also going to make sure that the tablet will be held under tongue until dissolved, and then I'm going to make sure that he avoids any eating, drinking, or smoking until tablet is dissolved. We're going to do some education real quick. So we're using this medication because of your high BP and your heart rate. It increases coronary blood flow by dilating coronary arteries and improving collateral flow to ischemic regions, just meaning that it increases your blood flow to the rest of your body. It produces vasodilation, so it will help bring your pressure down. It reduces myocardial oxygen consumption, so your heart won't have to work as hard. I'm going to go ahead and assess the location, duration, intensity, and precipitating factors of chest pain, and then we're going to be monitoring his BP and pulse before and after administration. Some common side effects of this medication are dizziness, headache, hypotension, and tachycardia. So now that we've done that teaching, I'm going to go ahead and check his MAR. So I'm going to make sure that I have the order number 1, and I'm going to do 2 patient identification. I'm going to look at his wristband and have him verify, and then I'm going to take his wristband and match it to the MAR. And then, so I'm going to go ahead. I've already got my meds out of the med out of the Pyxis. I have some water for him to drink. Once the medication is dissolved afterwards, just to get that taste out of his mouth. But like I said, I'm not going to let him drink anything until it's fully dissolved. So, I'm going to go ahead and check the order once again, making sure that it's for nitroglycerin 0.4 milligrams sublingual. I'm going to go ahead and do my patient right. So right patient, right time, or right patient, right drug, right time, right route, right dose, right reason, right response. So let's see, his blood pressure before giving this was 189 over 100. So like I said, I've already reassessed those vital signs. So I've already done my med checks. I've already verified his name and date of birth. So I'd have my little medication cup with the tablet. Okay, so I'm going to place this tablet underneath your tongue, okay? And I need you to hold it there until it's fully dissolved. So don't swallow it and don't chew, okay? So I have him lift his tongue up, and then I place the tablet underneath of his tongue. And then I'd probably actually just stay here and wait, and then I'd have him lift his tongue up just to check to make sure that it actually dissolved. And then 5 minutes later, I'm checking his BP again, and it came down to 142 over 90, and his heart rate is 70. So he reports his anxiety is decreasing, and temperature has come down to 100.6. So I obviously got the correct response that I wanted. His blood pressure went down, his heart rate went up, and his anxiety went down. So I'd go ahead and chart the vitals before I gave it, chart the vitals after I gave it, and then I'd chart what time I gave it, what route I gave it, which was sublingual, how much I gave, which was 0.4 milligrams. I'd also chart how he responded to it, so he had a therapeutic response to this. And then before I'd give this, I also would chart the symptoms that he was experiencing before I gave this, so that way I'd have a baseline. So I have a baseline of his vital signs and the symptoms. So then once I give it, I know if his vitals are improving and his symptoms are lessening, then I know that that's a therapeutic effect and it had worked. So yeah, pretty cool. Pretty cool. So some education that I'm going to provide for him and his family would be signs and symptoms of autonomic dysreflexia, and to know methods of treatment, so like sublingual nitroglycerin or chewable nifedipine. How to monitor his vital signs, that way they can make sure that he is getting the best care possible, making sure that he's not hypertensive or has bradycardia or tachycardia, anything like that. We want to go over some range of motion exercises and repositioning schedule and techniques, that way that he doesn't have any muscle atrophy, or that he doesn't get any pressure ulcers or anything like that. We don't want skin breakdown. So I would ask that they implement a repositioning schedule, so like every 2 hours, just making sure, even keeping like track of it, like a whiteboard or something, to make sure that it's getting done. And then when to report to the healthcare provider, and also what to report, so like signs and symptoms of pneumonia, DVT, or pressure ulcers. We want to report that to the healthcare provider at any of his follow-up visits, or if there's an emergency or something. So we're going to go ahead and move on to report. So Mr. White was a 17-year-old male. He had a snowboarding accident 3 weeks ago. He has a vertebral fracture and a complete spinal cord injury at T7. He had his fracture stabilized with rods and screws, and he's going to be discharged in 3 days with home health and family. He's not experiencing any respiratory weakness. I'm assuming that his intercostal muscles, though, are weak. He said he feels like he has to give a little bit of effort, more effort anyways, when he's breathing, but everything is fine. His vitals are 142 over 9. Well, okay. His vitals at the beginning of the shift were 189 over 100, heart rate 56, temp 103.6, respirations were 22, and pulse ox was 96. The CNA had given him a bed bath and accidentally left one of the washcloths underneath of him, so he ended up developing autonomic dysreflexia. He was feeling super anxious. His abdomen is soft and non-distended, though, and his bladder was also non-distended. So I asked CNA to help me. We got it, the washcloth from underneath of his back. We ordered some things, so we got some nitroglycerin. We went ahead and got him some cool cloths, and we also fixed the source of the problem, so we removed that washcloth. I went ahead and did some education to the CNA, explained to her what had happened and why it happened, and I also told her that, you know, it was a mistake and mistakes happen, but we just have to make sure that we're, you know, maintaining the safety of our patients. So I said to do a count of your washcloths or any, you know, anything that you're using to do any kind of procedure or activity with a patient, and then do a final count when you're finished. So if you have 4 washcloths, you need to have 4 washcloths at the end. So I did that, and then I thanked her for, you know, reporting those vitals. So I went ahead and gave him that nitro 0.4 milligrams sublingual. I gave it at 9 o'clock. His BP came down to 142/90, and his heart rate went up to 70. His anxiety decreased, and his temperature came down to 100.6. And then I also gave him teaching, some education on like the side effects, why we're using the drug, and further teaching plan or treatment plans. And I also did some teaching to his family on signs and symptoms of autonomic dysreflexia and how, and to know the methods of treatment, and then how to monitor vital signs, range of motion exercises, repositioning schedule and techniques, and then what to report to the healthcare provider. So yeah, we did some education on that, and I gave that man at 9. I said he hasn't had a bowel movement for me today or any output. So we've been monitoring that. So I already charted that he didn't have a bowel movement or anything today. Yeah, that's about it. Thanks for watching.